Hey ladies, how's everybody doing? So I just finished my maternal fetal medicine and what do you call that? OB appointment. It is April 9th, 2019, y'all. And the girls and I are doing very well. I came to the park. I was going to walk around and record, but there's a lot of children out here and I didn't want to get anybody's kids in my view accidentally. So just a few quick updates. Both babies are doing well. They're active. They're doing great on their biophysical profile, their practice breathing, their movements. Baby A would not stay still long enough to get her brain Dopplers measured, but baby B's number is fine. So when they're measuring for taps, if one twin has a very high number and the other one has a very low number, they worry about one of them being anemic. So the fact that baby B's number was right on target suggests that baby A's number is on target as well. Their fluid measurements were normal. Heart rates were within normal limits, so they look great. My blood pressure is still holding steady. My weight is still the same. I'm literally all baby and placenta and maybe a little bit of fluid because my hands got a little bit tight. I did get bitten by a spider or something, so I had to go to the Express Care on Sunday and get put on some antibiotics, and that's doing fine. Other than that, so I'm doing well. So in terms of plan, again, the maternal fetal medicine and my OB got together and decided that my delivery would be between 36 and 37 weeks. So I do have a date. I will be 34 weeks tomorrow. My doctor today, we were talking about a surgical approach because I have a rather round abdomen, and sometimes when you have like these additional abdominal folds, anytime you have a warm, moist place, there's going to be more chance for bacterial growth, poor wound healing. So we're trying to decide between a midline incision and a bikini cut. And to me, I mean, it's not like, even if I lose a weight, it's not a bunch of weight. It's not like I'm going out here in a two-piece anytime soon. So I would rather err on the side of caution, honestly, and get a midline incision versus being at risk for infection, going through antibiotics, dealing with wound dehiscence and all of that extra stuff. But we'll make the final decision once we see the final weight on the babies. And so they won't actually do a growth scan until next week at the 3-week mark, since my last one, and then we'll decide what incision I have to have. Also, my doctor is funny. He scheduled my surgery on a day when all of the residents will be in conference at main campus because I told him that I was not dealing with any residents. I said, if you're a resident, thou shalt not cut or sew, okay? Nope. The other part of the plan for my treatment while I'm in the hospital, he thinks he's going to put me on a blood thinner to decrease my risk for DVT. The next day after the procedure. So we got a lot of things coming up. I feel a little bit scared. I think I'm going to get a spinal block or either a CSE, which is a combined spinal and epidural, where they give you the spinal block and they have the epidural catheter in place, but they don't dose it unless they need to. So the spinal block starts working faster. But yeah, so we're doing this first thing in the morning that day, lights, camera, action. And I will let you all know the day of when it's showtime. So that's all I wanted to tell you. So we have in the works a plan for what type of incision. We'll know next week how much the babies weigh. I'm looking good. Blood pressure's holding steady. Weight's holding steady. And both babies are acting appropriately. So that's where we are. And I will update you all real soon. Thanks for praying for me and sticking with me. Bye.